All right, sounds good, Madeline. Thank you very much. We do turn now to a safety alert at 3 after Heartland health officials sent an advisory about an addictive, unregulated kratom product. It's called 7-OH, and according to the Missouri Department of Health and Senior Services, it carries some serious health risk. It's derived from the kratom plant and sold in a variety of forms, including gummies, candies, powders, and liquid shots. It occurs naturally, but some products contain an enhanced version of it. Health leaders say it's possible to become addicted to the product, which can have opioid-like effects. You can also overdose or even die. A Kansas City man described his experience with the substance.
Was using, but I didn't even want to anymore. It was just making me miserable and always broke.
That man says he began using kratom while in rehab for his alcohol addiction. Kratom is banned in 7 states and Washington, D.C., and 18 others have at least some regulation, like Kentucky and Illinois. But take a listen to this. Missouri is not among them. We are so happy to have Ryan Essex with the Gibson Center for Behavioral Change live in the studio with us today on Heartland Afternoon. How are you, sir?
Good. Thanks for having me.
Yes, and thank you so much for taking the time to be here. You were telling us just a little bit before the show, locally speaking, we aren't seeing too big of an impact of that just yet.
To my knowledge, we haven't seen a tremendous impact yet. Just like most of these products, as they come to market, we probably will see some effects at some point in time. And our primary focus is to be able to educate the community about the resources that are available and the things that we can do to prevent dependence and health-related issues and death.
Mm-hmm. And anybody who may not know you like we do, can you tell them just a little bit about what you do?
Sure. The Gibson Center for Behavioral Change, we've been around for nearly 50 years now, providing substance use treatment to Southeast Missouri from a medical perspective, also residential and outpatient care, and just whatever we can do to help the community.
So if somebody is going to try one of these products, I mean, do you have any recommendations?
Well, my recommendation would probably be not to try it, but if you are, I mean, there are, I'm sure, instructions on the packaging. Use it as the package directs, and as with any product like this that is an opioid derivative, we always recommend a person having Narcan or some naloxone overdose reversing product available at all times. We would encourage all community members to carry Narcan, as you never know what situation you might encounter on the street any given day. So Narcan can save a life.
Okay, and we do also want to share this with you really quickly. The Missouri Poison Center received nearly double the number of exposure reports in 2024 in the first 7 months of this year. We're talking symptoms including nausea, vomiting, anxiety, agitation, also confusion, rapid heart rate, high blood pressure, and trouble breathing, and even seizures. So, Ryan, what should someone do if they think they've been exposed to a substance?
I would say call poison control. Would be, you know, if a person that you're with becomes unresponsive, obviously call 911. But if you believe there's some type of exposure or accidental exposure, poison control would be a good place to start. You know, local health department, hospitals, you know, us at the Gibson Center would be great.
I mean, just taking a look at that video, this looks like, some of the packaging looks almost like candy.
Yeah, I mean, unfortunately, a lot of these products are marketed and packaged in a way that make them look like products that you can buy in a convenience store, or, you know, I don't want to say who specifically they're marketed to, but yes, they are marketed in a way and packaged in a way that, you know, you can take from that what you will.
Okay, so I also want to ask too, if somebody knows somebody in their life who might be facing this addiction and they're not wanting to really come forward, what are the resources available?
Well, if they're not wanting to come forward, I mean, certainly there are many resources available online, community meetings available for family members of individuals struggling that are available out there. Certainly you could call us at the Gibson Center for Behavioral Change and we can direct you to those resources.
Okay, you guys do great work. We appreciate you guys very much for taking the time to be here.
All right, appreciate it.
All right, we're going to send things over to the First Alert Weather Center with our very